Okay, during medical school, we have to decide what specialty in medicine we want to train in. For me, I decided on anesthesiology towards the end of medical school. When I looked at the things in medical school I found interesting, and that was pharmacology, or studying how drugs work and how drugs affect the body, and physiology, which is sort of how the organs of the body work. And I found anesthesiology was the best fit for that. As in anesthesiology, we tend to use drugs to control people's physiology, keep them alive during their surgeries, and control their pain and keep them asleep. After I completed medical school, I started a 4-year training program at Stanford University in anesthesiology. So during this time, I spent 4 years training, learning how to be a basic medical doctor, just taking care of sick people, and an enormous amount of time training in the operating room and in the intensive care unit, learning how to do all the skills and medicine that anesthesiologists use in their daily practice. Some of the hardest things I experienced during my training in anesthesiology include the number of hours spent in the hospital actually working, oftentimes upwards of 80 to 100 hours a week. Additionally, there was an enormous body of knowledge we had to acquire. So even when I wasn't in the hospital working, I had to spend quite a bit of time studying and reading on my own, learning about anesthesiology and medicine, and thinking about and practicing the skills that go along with that. So after I completed my training in anesthesiology, the next step was to get a job out in the community with a hospital. This had its own set of challenges. I live and work here in the Bay Area, and it's a competitive job marketplace in that everyone in the country seems to want to live and work here. So there were a lot of interviews, and I really had to work hard to sell myself to the hospital where I ultimately worked in order to get a job there. So now my day-to-day experience in the hospital can be really variable. I do an enormous amount of anesthesiology, of course. I also do some work in the intensive care unit. On any given day, I might be taking care of very sick patients in the operating room, having big surgeries, or in an outpatient surgery center doing very minor procedures, small knee operations, or very minor eye surgeries, and sometimes just providing sedation or medications to help people just be relaxed during very minor procedures. So, and if any young people are interested in becoming a doctor or getting a career in medicine, it's important early on in high school and college to get exposure to the sciences, so biology, chemistry, physics, and doing well in those classes. Additionally, it can be helpful just to see if you find working in this environment interesting, to try to get some exposure to healthcare, so volunteering in hospitals and clinics, talking to physicians in the community that you meet, or if you have friends of the family, spending some time talking to them about what their jobs are like can be very helpful.